This is the case of complete AV septal defect, double outlet right ventricle, severe pulmonary stenosis, and Glen shunt. In this apical fourth chamber view, this is left atrium. So this is left atrium, this is left ventricle, and this is right atrium, right ventricle. As you see, this interventricular septum, then this inlet VST, then common AV valve. In case of ostium primary ASD, this interior septum, then ostium primary ASD, then common AV valve. That is how to identify this common AV valve with ostium primary ASD and inlet VST. Simply D-shaped left ventricle indicating raised right ventricle systolic pressure. Now you can see the most of great arteries, most of aorta is coming out of right ventricle. Same thing, you see the right, this is aorta and this right ventricle, and aorta is mainly coming out of right ventricle. Same thing, same thing. And right one, this is flow across pulmonary artery, that is also coming out of right ventricle. This is flow across pulmonary artery. This turbulence, you can see the turbulence in this flow, but that flow you will not find that much turbulence. So this is supraesternal view, and this is superior vena cava having blue flow dilated. Again the same thing, how the this is right pulmonary artery branch, and this is superior vena cava, and that is superior vena cava is connected to a right pulmonary artery, that is Glen shunt. So Glen shunt is best visualized through supraesternal window, because we find clear cut superior vena cava at same time communicating with right pulmonary artery. Same thing, there is no flow obstruction. Same thing you see there. This is superior vena cava, and this is right pulmonary artery branch that is communicating with right pulmonary artery. In this bicaval view, this is bicaval view. This is inferior vena cava, this is left atrium, this is right atrium, and no, you cannot find out SVC connection here. You see, you don't find any flow from SVC. So this is IVC, this is left atrium, and very small ostium secundum ASD that is coming to right atrium. This red flow, this red colored flow, no communication from superior vena cava. So this is bicaval view, subcostal window. Same thing. Now you can clearly see this is the aorta coming mainly from right ventricle, and this is pulmonary artery. See, so aorta and pulmonary artery is normally related. That means if you see the long portion of pulmonary artery, then that will be the short portion of aorta. That is, in one is in the long form, another will be in the short form. That means cross section view of aorta and the long portion of the pulmonary artery is in. That means normally related. Pulmonary artery size was small compared to that of aorta, and severe flow obstruction in at the level of valve. You can see in this image. Obstruction is starting at the level of valve. See, this is right pulmonary artery branch. This is left pulmonary artery branch. Right pulmonary artery branch is not separated from left pulmonary artery branch. Only it is also getting blood from superior vena cava. Right pulmonary artery is connected with superior vena cava. You can see this image. This is parasternal short axis view. This is aorta. This is main pulmonary artery. This is pulmonary valve. Flow obstruction across pulmonary valve. Again the same thing. Same thing. So I want to show you how much gradient. You see, this is the gradient across tricuspid valve. Velocity wise it is 4.6 meter per second, or P gradient wise 85 millimeter mercury across TRZ. You see across pulmonary valve, velocity wise 5.25 meter per second, and gradient wise 110 millimeter of mercury. So severe pulmonary stenosis mainly at the level of valve. You can see this velocity, that is almost normal. So there is no significant subpulmonary valvular obstruction. You can see this is the flow before obstruction, and this is the flow with obstruction. So gradient wise is very high. This much gradient. Now you can see the gradient. So this is the case of complete AV septal defect, double outlet right ventricle, severe pulmonary stenosis at the level of valve, and Glen shunt view. This is Glen shunt. This is SVC. This is right pulmonary artery. This is Glen shunt, and this portion indicates flow in aorta. It's red color. Thank you.